Greetings and merry me. I am Katrina the Good with the Phenomena Encountered Radio Network, and I'm coming to you with another video. And the topic of this video is going to be a little bit different than my norm. Magic, energy work, paganism, things of that nature. It's actually regarding hospice and the dying process and what to expect with both. I am a hospice nurse, and I'm very passionate about the work that I do. So I thought it would actually be a pretty good idea to share some of my experiences and knowledge of what hospice is, what it is not, and what to expect when a loved one is dying. I have found that the more information, the more educated family members are regarding what is happening to their family member as they're dying, the more comfortable and at peace they are with them being in hospice, because I do believe that there is a lot of guilt or a sense of sadness when coming into a hospice house, because it's almost like they're just giving up or dumping their family member off, and that's most certainly not the case. Now, I've only worked for one hospice organization, but so I'm going to explain and express my experiences through this one organization. However, I'm certain that hospice companies operate in the same essential way. So I'll start off with what hospice is. And hospice is the care of terminally ill people. Normally, at least with my organization, all of our patients have it given a prognosis by 2 doctors that they have 6 months or less to live if their disease process continues as it is. Now, nobody has a crystal ball. Nobody can tell for sure when somebody is going to pass away. So there are instances, a lot of instances actually, that these people do outlive their 6 months prognosis. They can live for several years afterwards. It really does happen. Now, when a person comes into a hospice house, they are really there for symptom management. And the 3 main symptoms that my facility manages is pain, anxiety, and shortness of breath. Now, is everyone there to die? No. Now, just because you're going to a hospice house does not mean you're going to have to necessarily die there. We do have people that are up walkie-talkie, and we've had instances where people are not even aware that a person is a patient at the facility. They're just there for manage their symptoms and get those under control, whether they're having great pain due to cancer or any other issues, shortness of breath with COPD, emphysema, or any other issues of that nature, and anxiety. But anxiety can also be branched off of pain and shortness of breath. You can't breathe, of course you're going to be anxious. Once those symptoms are managed, usually through medication, that person is able to go home. Now, when a person is actively dying and comes to us, we are on top of the same thing, managing their symptoms and keeping them comfortable and make sure they die with dignity. As I said, it's pain, anxiety, shortness of breath are the 3 most common symptoms that we take care of. I've had family members that are very frightened of morphine, as they feel that it is going to make their loved one pass away faster. And I'm here to tell you that is not the case. Morphine does not speed up the dying process. Lorazepam doesn't necessarily make a person just completely sedated. They both, morphine and lorazepam, or Ativan as it's more commonly known, work very well together as to manage the pain and anxiety, as well as shortness of breath. Now, what morphine does is not only does it control pain, it also slows down the breathing. Because if a person is breathing rapidly or having rapid short breaths, they're not getting the proper amount of oxygen that they need, which in turn causes more anxiety. So what morphine does is slows down the breathing so a person is able to get the most oxygen out of each breath that they possibly can. It can make a person very tired, especially if they need more morphine than necessary. We start out with the smallest dose that we have, and then we'll work our way up. We're just not going to start with high doses of morphine and Ativan. It's just not how we operate. Now, many people say, well, they don't look like they're in pain. Why are you keep on having this round-the-clock morphine? No, they're just sleeping, they're just resting. Why are you giving morphine and Ativan every 4 hours? Well, that is, for the purpose of that, is to keep them comfortable, because it is very, very difficult, and it takes a lot more time to bring a person that is having a 10 out of 10 pain level with high anxiety trying to jump out of the bed. It takes a lot more medication, a lot more time to bring a person back down to a comfortable level. If they're on a steady regimen, which a low dose regimen, then they have that medication continually throughout their body, and then they stay quiet, they stay comfortable, and the family is able to connect and have that time with them that they still have without having to worry about them, trying to jump out of bed or hurting themselves and things of that nature. One of the more difficult forms of anxiety that is difficult to manage is called terminal agitation, and that is when a person becomes even closer to their end of life. It's almost like a burst of energy that they receive, and we've had people climbing out of bed, trying to stand on the bed. We actually had one gentleman actually stand up out of bed, pull open a side drawer pull open a drawer on the side jut and sit in it and break it. He did pass away a few hours after that after that incident. That is common. Another common side effect for a person that is getting closer to death is high fevers, and fevers that are unable to come down with use of Tylenol. That's just the body just trying to fight off, because it is the body's natural reaction to keep it alive for as long as possible. But with age, cancer, and other ailments or trauma, of course that's not possible, but the body doesn't know that. Other things also is called mottling, which is a pigmentation of the skin. And that mottling usually occurs starting at the feet. And the skin will turn almost like a grayish purple color. And that is also the body's attempt to keep it alive as long as possible, because it's preserving blood that it needs to keep the vital organs alive, because you don't need your feet, you don't need your legs to live, but you need your heart, you need your lungs, you need your kidneys in order to live. So arms and feet are the first to start saying, because you don't need those to live. So blood flow will stop coming into the arms, and just focus on what the body needs to survive. Let's see what else. Oh, here's another thing that I get often, or families get really upset at, is when a person stops eating or they feel that we are starving them. And once a person gets to a certain point in their experience or their disease process, they no longer need food. And at times, food can actually make them die faster, and I'll explain that. If a person's stomach and body is not processing or functioning like it should, the food is going to sit in the stomach and it's going to stay there, and it's not going to be broken down. It's not going to be, the body's just not going to use it. It's going to sit there. And the same goes with fluids, water or any other beverages. It's just going to sit in the body, and if it has nowhere else to go, it's just going to go anywhere else. There's too much fluid. There's swelling of the hands and feet, because the fluid just has nowhere to go. The body's not using it anymore, so it's just going to stay in the blood. It's going to stay under the skin, and a person becomes very swollen and very squishy, almost squishy feeling. And that's because the fluid has nowhere to go anymore, because the body doesn't need it and it's not using it. And that's the same can go with food, and that could also called what's called aspirations, which food and fluid goes into the lungs, which causes like aspirated pneumonia, and a person essentially drowns in their own fluids. It's a very unpleasant feeling. That person also gets very high anxiety, because you're basically drowning and it's just not a good feeling at all. And I understand we as humans see food as life, but towards the end of a disease process, it really does cause more harm than good. What do I get quite often? Oh, here we go. Another something that is seen quite often, or symptom of the dying process, is towards the end, we have our patients that are, complaining of people that are not there. There's too many people in the room. Please ask the children to stop running in the hallway. Please get the dog out of my bed, or bring the dog onto my bed, and in some other cases. Or you'll see people like reaching out for a person. Of course, many believe that is loved ones that are waiting to take them to the other side. I'm one that personally believes that is in fact the case that is occurring, because it just happens so often. And it's always those who have already passed on. Brothers, sisters, mothers, grandparents, even pets. It is very interesting and quite a spiritual experience to witness. And with some families, that brings a great deal of comfort, knowing that they're not going to go to the other side alone. And other families, it causes them great distress because they're just not ready to let go of their loved one, which is understandable in both parts. Everyone's experience of the dying process is very different. Some families are ready, some are not. And hospice is really there to help not just the person that we're treating, but the families as well. Spiritually, we do have our chaplains on board every day to help with any spiritual needs. There's those of other faiths. We are able to, or even just a preferred priest that they would want to come in to do, final rites or secretary of the sick, things of that nature. We're able to bring a priest in, or priestess, rabbis, whomever, into it, so the person can go according to their faith, which is also very important. We do everything that we can to respect everyone's belief systems and make sure that they're treated according to what their scripture is. Let's see, we've had everyone that you can think of. Jews, Christians, Catholics, Muslims. We've had pagans and Wiccans. Not at we haven't had Wiccans at my particular facility, but I have heard of other locations and other branches. And so, but all of those faiths are respected and treated accordingly. If there are any special rituals that need to be done before a person passes away, and we see the person is getting closer, we do call the family, and they're able to come in so they can perform these rites for them according to their wishes. It really is quite a beautiful process. I understand that, seeing a person that you love pass away, but it really is okay. And I get asked often how I'm able to, do this every day. Actually, I don't do it every day. I work 3 12-hour shifts a week. But how I'm able to see death so often. And I don't like to say that one becomes numb to it. I do have my defense mechanisms. I rather have a twisted, dark sense of humor. I watch way too much wrestling, things like that, and that's how I unwind from what I do. I knew a nurse that every day she would watch the movie Happy Feet, and that's how she got through her shift, was watching Happy Feet every day. If she's watched it, I don't know how many times she's seen it. But you do have to distance yourself a bit. Of course, some deaths hurt more than others, and some I still with me even to this day. And people have passed away almost 10 years ago, and I still miss them. It's very difficult to completely separate yourself from a person, because you do have to have that level of compassion and tenderness to take care of a person and family when they're at their most vulnerable. I really do hope this video helped, And I just want to say blessed be to everyone and have a wonderful rest of your week.